Hi everyone, my name is Jared Drosky, and this is my presentation on gum disease. Gum disease is a combination of two things, gingivitis and periodontal disease. So you may be asking, what is gum disease? Gum disease is an oral disease caused by bacterial growth, usually in the gum line and the tissue beneath it. Periodontitis is the gum disease part, and gingivitis is the inflammation prior to periodontitis. So how it works is bacteria grows on the gum line or on the tooth, and this causes pockets because of the decay. Toxins from the bacteria are brought out, which breaks down the bone and the tissue beneath it. And this is the number one reason of tooth loss in adults. So besides the teeth, it also increases the chance of heart disease, stroke, diabetes, and cancer. This can lead to death in some people. As you can see by this graph, any age can be affected by gum disease. However, as you get older, the chances of getting it, of periodontitis, is increased by a lot. If you look underneath the graph, or the bottom part of the graph, the severity of periodontitis shifts between each age, while moderate and mild increases as age progresses. And yes, it does affect different animals. Gum disease is mostly affected by domesticated animals and humans, but it can affect any species. In fact, it's the leading disease in cats and dogs, which almost 90% of dogs will develop a form of periodontitis disease by the age of 2. In fact, it can shorten a dog's life by 2 years. The reason why animals domesticated don't really have to brush their teeth is because their food is full of fiber and they're usually harder, so they spend more time eating it, which can clean their teeth. Wild animals have the same things. They don't have the sugars and carbohydrates that we have in our food that affect our teeth more. Some symptoms of gum disease is bleeding gums after brushing, red and swollen gums, receding gums, formation of the pockets in the gums, persistent bad breath, and loose teeth. Gum disease is a sneaky disease because it progresses painlessly and it's hard to self-diagnose. Only a dentist or a professional can recognize the severity of the disease. So it's important to go into your 6-month dental cleaning because they'll take care of the gingivitis before it progresses into actual gum disease. The reason why it's important to go in and get gingivitis taken care of is because later stages are not treatable. If you get into a later stage, even bone and gum surgery can't help it. In early stages, it can be prevented by brushing your teeth, flossing, and using mouthwash on a daily basis. This includes throwing out old toothbrushes that may not be effective, using fluoride toothbrushes, and this can be not used if you are drinking tap water, and using mouthwash that is actually effective. Professional cleaning can also do it. Uh, every 6 months when you go into the dental hygienist, they usually take care of it. Later stages can be taken care of by a dentist in a deep cleaning. Antibiotics can be used short term because of resistance. Chlorhexidine mouthwash can also be used persistently to prevent it, although that causes staining. And bone grafts and gum surgery can also help prevent it from worsening, but also maintain the integrity of the teeth so they don't fall out. And here are my cited sources. Thank you for listening to the presentation, and I hope you all have a great day.